I'm a retired detective sergeant from the New York City Police Department. I served what would be 21 years. My last 3 years, I was a supervisor in the Organized Crime Control Bureau, where basically I worked in Bronx narcotics and I also worked in Brooklyn North narcotics.
We in harm reduction work with folks to keep them alive while they use drugs. So we work to promote their safety, their dignity, and we work with them on gaining access to treatment when they're ready for it. And we work with them on reducing their drug use if that's what they want to do.
Basically, I supervised a drug module that basically on a daily basis conducted buy and bust operations. My particular team was a leading team in search warrant executions in Brooklyn North. And I started thinking, what am I doing on a regular basis in this narcotics unit? I'm arresting people for drug-related offenses, and people were going to jail. People were having their lives impacted because of this. When we use a seatbelt in the car, technically we're using some form of a harm reduction type of method. Trying to find a way of treating people without stigma and without being judgmental towards them. Understanding the overall complexity of the phenomena of substance use disorder and how it can move along a continuum that could range anywhere from total abstinence all the way out to just finding a safer way to use drugs. What we're doing is that we're telling them, let's do it our way. And our way is systematically been set up, to basically move forward and say, you do it or you've failed. In other words, we don't look at like just incremental changes that people make in their life that we will look at as a positive. When you meet someone where they're at, we're looking at all those small incremental changes. If a person is using some form of a substance and a person is homeless, if I'm able to find that person a place to live, but they're still using drugs, I've still improved the quality of their life because I've given them a place to live. So meeting people where they're at is just understanding with a heightened level of compassion.
It's really important that prosecutors make an effort to support harm reduction legislation, to support harm reduction programs, to make sure that there aren't barriers to access to care. Harm reduction is important because some places we have no treatment that uses evidence-based medications for opioid use disorder and doesn't have access to contingency management if they're a psychostimulant user. It may be that there's no recovery communities. We need every tool at our discretion in order to reduce those deaths.
The need to arrest someone is not going to take us away from the 93,000 deaths that have just most recently been reported for 2020.
We know one of the most effective tools is access to harm reduction programs to reduce overdose death. Increasing access to naloxone is vital in order to reduce overdose, and we have the evaluation data to show that it is one of the premier effective tools in reducing overdose. Another thing we know is that syringe service programs severely reduce HIV and viral hepatitis. They're also associated potentially with up to a 11% drop in crime. They're preventable deaths with harm reduction programming, and it's vital to provide that bridge to extended services. It's taking public stands in support of harm reduction. It's taking public stands to support syringe service programs. It's taking behind the scenes stands and talking with members of law enforcement and the community about the benefits of these programs. We know the other keys to the equation are building up using evidence-based treatments that use medications for opioid use disorder, supporting recovery initiatives throughout the country, and also address the underlying reasons why people use drugs in the first place, which normally has to do with the social determinants of health and unmet behavioral health needs and adverse childhood events.
I think that everything begins with just an acknowledgement of who you are and the job that you're actually doing. Oftentimes we have a way of segmenting our thoughts and categorically like applying a division to what our responsibility is versus what another person's responsibility is. I think it's really, really important for prosecutors to understand how fundamentally they are important to like any true changes that can be made. My primary concern is primarily geared around those that are what would be possessors, people that are street level sellers, so on and so forth. People whose lives that maybe we can change if we don't necessarily use the criminal justice system as a tool, as a mechanism of getting that change done. If we're actually knowing that someone's instrumentally moving large quantities of drugs, our people are impactfully affecting communities through large amounts of drug sales, I can't honestly tell you that even with my harm reduction background, I don't believe that there does need to be some level of punitive measure to some degree. But once again, people that are it's the lower level, and really, to be very honest with you, the drug trade exists primarily 90% the lower level. So what I'm really saying is it's the 90% level that we need to leave alone, look at, and wonder why are we 25% incarcerated in our country. Sometimes the best way to move them through the system is to divert them out of the system.
I would also recommend that prosecutors also look at what are some of those barriers to care in your home state. Is it that it's really hard to open up a methadone or buprenorphine place of business? Is it really hard that people to have those massive transportation barriers to get to care? Is there law that potentially prevents telehealth or mail-based services? I would encourage people to meet with people who use drugs, people who are on medications for opioid use disorder, and people in recovery, as well as people who have received behavioral health treatment in the community, and learn what are the barriers to success.